here on the Fox 5 Live Zone. So over the past decade, discussions about mental health have really exploded across public discourse. From social media campaigns to corporate wellness initiatives, the message is real clear. Talk more, share more, and reduce stigma. Joining us now to discuss all things surrounding that, hey, our guy is back. Dr. Mina back here on the Live Zone. Good to see you, sir, and welcome to the show.
Great to see you as always, Guy. Thank you for having me.
Yes, very important topic. That is, yet again, mental health. And I'm curious, as a society, would you say that we're paying more attention to mental health in this day and age?
I think we are, Guy, and I think there's a unique opportunity within this topic of mental health. My favorite part of it is how we can think about screening. Imagine if we're in a place where we're seeing an epidemic of cancer, colon cancer and breast cancer, and we have something like colonoscopies and mammograms, but no one's using them. It's one thing to be able to talk about the problem. It's a much bigger thing to be able to say, how can we catch this early and prevent it, not just reduce stigma, but actually catch things earlier so we can treat them better.
Well, it's no secret, 1 in 5 adults now experiencing a mental health condition each year. The question yet again is, how can screenings really help reduce those numbers?
Well, this is the wonderful thing that we're seeing, guys. One of the reasons I'm so excited to talk about this topic. Anything in our lives, when we see a little crack in your windshield or you smell smoke and you wonder if there's fire, mental health is in the same way. We've seen from data now that you can catch up to 45% of these undiagnosed disorders like anxiety or depression or suicide if you're able to get into the game early and you're not able to just wait until a crisis happens, but rather take an early preventative, proactive approach, because an ounce of prevention is worth a pound of cure, and that's what we see in mental health.
Given that half of mental health conditions go unrecognized as it currently stands in primary health, what does an effective screening process look like?
Well, this is the wonderful thing about screening in mental health, Guy. This is not a colonoscopy. This is not going to be an invasive process. You're not going to be, going through something very difficult. It's actually a conversation. It's very effective. It's a number of questions because oftentimes we put the burden on the patient to be able to reach out, ask, find someone. As opposed to here, in primary care, we're able to ask you these 7 questions for anxiety, called the GAD-7, or the PHQ-9, 9 questions that go through symptoms of depression. And through that, we're able to actually put a grade or a number to how severe what you're feeling is. And when we know that, we can quantify it and get you well on your way to actually being treated. It's remarkable, it's simple, and it's effective.
Dr. Mina, it's no secret also, it takes nearly a decade for people really to receive a diagnosis. And one would have to ponder, how could one find out as to whether or not they're suffering from this early on?
Well, this is the heartbreak, Guy. I had a patient tell me last week, and I asked them, how long have you been feeling this down in the dumps, depressive way? He said, for as long as I can remember. And NAMI had told us that it takes over around 11 years from the time someone begins to experience symptoms to the time they get treatment. Imagine if that's the case for any other physical health condition that we have, that we wait 11 years until we're actually able to reach treatment. This is why this is such a unique opportunity, that we can able to catch up to 80% of these undiagnosed disorders and actually make a huge difference in somebody. Instead of waiting over a decade, you can actually make a big difference by having early screening and detection.
Dr. Mina, let's talk about suicide. We now know that suicide is the second leading cause of death among young people. What role, yet again, does screening play to make sure that we can really reduce that number?
Well, this is huge, Guy. This is why oftentimes we can be a bit reactive. Whenever we hear about a major suicide of a celebrity, I remember when we first lost Twitch, who was a major figure, or Robin Williams. We can begin to just say, well, what could we do now? How can we react in the moment? But rather, we can think of, there are all these subtle signs and symptoms of suicide. And these screening questions, like the Patient Health Questionnaire 9, actually begin to plant that seed of, let's find out if you are having risk behaviors or risk thoughts, a thought or an idea about suicide, an intention, a plan, something where at home, if you can make some very simple modifications of keeping access away from firearms, making sure that your pills are locked up, all of these small but very effective interventions go a long way in preventing suicide, not just waiting until we hear the next major heartbreak, but rather getting ahead of it.
We'll end with this, Dr. Mina, and that is preparation is key. How many times have we all heard that? You made mention of a colonoscopy earlier. I had one done last year, and it was all about the preparation process. Yet again, when it comes to mental health screenings, can you speak to what the preparation process should be for a patient?
Yeah, absolutely. Luckily, again, it's not as bad as the preparation for a colonoscopy. All we have to sort of get our mind into is I'm going to be answering a couple of simple questions. There are sometimes these screenings that go on to either a primary care office. I used to actually work with a company that would do this all around the country. And sometimes we've been doing with Athlete Mental Health Week this past week for Athletes for Hope is getting on a college campus and saying, we're going to ask you 7 or 9 simple questions. So to prepare, you say to yourself, how can I be as honest and forthcoming as I possibly can? I don't want to hide anything because whatever is hidden will not be treated. So as a patient, I come in and say, I want to be able to have access to resources. I want to be able to have a frank and honest conversation and discussion. And in so doing, that can save my life.
And in so doing, we feel a lot better about the actual process because you explained it oh so well. Folks that want to find out more information about Dr. Mina Merhome, how would one go about to do so, sir?
Definitely invite you to, thank you for that compliment too, Guy. I invite you to come on to drmerhome.com. I love to be able to share evidence-based resources and tools so that we can live life a more fulfilling, flourishing, and full way as well. So thank you for having me, Guy.
Easy as 1, 2, 3. Always good to see you, sir. Thank you so much for coming on the show. We'll take a quick break, guys. We'll be right back.